Hello friends, and welcome back to my channel. For those of you who are new here, my name is Brianna, and on this channel we do lifestyle videos. I love doing videos about cooking and cleaning and organizing and mom hacks, and I love doing educational videos also, like the one that we're going to be having today. And all of these are from the perspective of a busy nurse mom. So if that is something that you are interested in, I would absolutely love to see you stick around. So hit that red subscribe button down below so that you can be a part of this community of other nurse moms who are here to support each other, to lift each other up with positivity, and to help each other to find that balance in our lives that we all crave. Thank you again for being here, and let's get right into today's video because it is a juicy topic. We are going to have some coffee and conversation today. We are talking today about the COVID-19 vaccine, and let me tell you why. We are about to start getting these vaccines in the area that I live in, and I have a lot of patients who are asking me questions about this vaccine that, to be quite honest, I wasn't sure how to answer. So I decided that I needed to be educating myself on this because it is part of our job as nurses to give our patients the best information possible. And I don't know if you guys realize this or not, but nurses are the most trusted profession in the whole country. Yeah, you heard me right. People trust nurses more so than any other person, and that is a huge responsibility if you think about it. People are looking to us for advice about their health and their well-being and their life. So we had better get our facts straight and get this right. Nurses are the people who are the most connected with our patients, and we are often the ones that are doing the most education with them. We need to make sure that we are getting our information from a credible source, not Facebook, not Instagram, not Aunt Sally, not our neighbor down the road who, has their opinions. Everyone has their own opinions. But today we're going to talk about real questions that my patients have asked me, and we're going to talk about the facts from credible sources so that you know what to say to your patients when they ask you these questions as well. So let me get out my list and we'll get right to it. All right, so question number one. How does an mRNA vaccine work? That is a messenger RNA vaccine. How does it work? So the mRNA vaccine teaches our cells how to make a specific protein that is in the COVID-19 virus. And so then our immune system knows how to make antibodies for this specific protein. And that is what keeps us from getting sick. The cells break down and they get rid of the mRNA after they're finished with the instructions. Kind of like this vaccine is sending your body an email saying, hey, I've got some news. I'm gonna show you how to make this specific protein for this nasty virus that's going around so that you don't get sick. And then when I teach you how, I wanna know that you know how. So we're gonna do a little fire drill so that I know that you know what I'm talking about. And then when it's finished teaching, the body gets rid of the mRNA and it's no longer in your system. Kind of like on that movie with Tom Cruise. What is that movie? Where he gets the message and it's like, this message will self-destruct in so many minutes. Sort of the same thing. So this vaccine is sending your body a message, teaching it how to make this specific spike protein that will keep you from getting sick. Question number two that I hear a lot. Will this vaccine make me sick? And the answer is no. The vaccine does not make you sick. But what it does, like we talked about before, is it says, I want you to do a little fire drill so that I know that you know what I just taught you and that you don't need my assistance anymore. So your body revs up its immune system and you can have symptoms like fatigue and fever and chills and body aches. And that is just your body's immune response doing what it's supposed to do, making all of these antibodies, doing its little fire drill, letting the mRNA know that you got the message loud and clear. So they typically come on, I would say maybe a few days after you've had your first vaccine, and they usually go away after a day or two also. And I just want to add that this vaccine is not a live virus at all. There is no live virus going into your body with this vaccine whatsoever. I've heard other people say when they're resistant to getting vaccines, oh, I'm not getting that flu shot because last time I got that flu shot, I got sick and I'm never doing that again. Well, I mean, that's kind of what it's supposed to do. You didn't really get sick with the flu. And, there is always this small little window of time that it takes your body to build up the antibodies and build up some immunity to these viruses that you could come in contact with the virus during that point before your body has had a chance to ramp up and make all of those antibodies. COVID-19 virus actually has a really long incubation period, like 2 weeks long. So when you're getting this vaccine, it takes a hot minute for your body to get it together and start making these immunities and start, copying this spike protein to make you not sick. And in that time period, you could very well come into contact with the COVID-19 virus from someone while you're, out grocery shopping or riding the bus to treatment or wherever you might be, and you still might get sick. But it's not because you got the vaccine, it's just literally you're in the wrong place at the wrong time. So that's why most people say, oh, I'm not ever doing that again because that made me sick. It didn't really make you sick. It was either your body's immune response doing what it's supposed to do to build up your immunities, or you were in the wrong place at the wrong time. And that leads me to the next question that people ask, if I get this vaccine, why are they still telling me that I need to wear a mask and that I need to social distance and that, I need to be protecting myself if I have these immunities? Well, first of all, because like we said, it takes a hot minute for your body to get it together to build up these immunities. So you do have to be protecting yourself still between this first and the second vaccine, and even a little bit after the second dose of the vaccine, because your body has still not built up all of the immunities that it needs to protect you against this virus, because it simply just hasn't had time. It's a process. And secondly, we don't know how long actually these immunities last. If you've had COVID-19, they're speculating from other people that I have talked with, other doctors and pharmacists and so forth, that these immunities only last about 3 months. So after the 3-month period, you think, oh, well, I've had COVID before, so I did all right. I don't guess I really need to get the vaccine. But yeah, you do, because your immunities are only going to take you so far. As far as how long the antibodies last after you get the COVID vaccine, we don't really know, because we still have to study that. People have to get the vaccine, and then we have to wait months afterwards and test for antibodies. Otherwise, we just aren't going to know that yet. Another question that I have heard asked, and this might sound silly, but it's a legit question that people have asked me. They have asked me, will this vaccine alter my DNA? Yes, I have been asked that. And the answer is absolutely not. The mRNA from the COVID vaccine never enters the nucleus of our cells, and that is where our DNA is kept. So it is impossible for the mRNA and the DNA to ever interact with each other, or for one to affect the other. And I think the biggest question that I've had from the most people is, how in the hell did they make this so fast? Like, why would I be taking a vaccine that is so rushed? Typically, I know these things take like decades to make, so why would I be lining up for something that they did in like a 1-year period? So let me just set the record straight. The vaccine did come fast, but the technology behind it, such as the mRNA delivery system, is not a new thing. Scientists have been working on mRNA vaccines for decades now with other viruses such as Zika, cytomegalovirus, even the flu. It's just a different type of delivery system than your typical vaccines that expose you to a little bit of the virus. This doesn't expose you to any of the virus. It teaches your body how to make a protein that protects you against the virus. So it's simply a different delivery system, and it is not new. It's been worked on for decades. These big pharmacy companies are really, really tough to convince to invest in certain technologies because it costs them a lot of money. And they're not going to want to put all of their money into a vaccine trial that may or may not work. So what happened is when the pandemic hit, the government said, I'm going to take the financial risk out of this equation for you, talking to the, big pharma and all of that. I'm going to take the risk out. We're going to fund this. So you back it, we'll fund it, zero risk to you financially. And so they were like, okay, phase 3 trial, here we go, because they'd already been through all of the other trials with these mRNA vaccine delivery systems. So they were like, okay, phase 3, here we go. This is where we test it on humans. This is where we do all of our efficacy testing. This is where we test the effectiveness of it. And it went through rigorous testing for the last year. So it's not necessarily rushed. It has been being worked on for decades now, just not with this specific protein. Now let's talk a little bit about some questions that I've had from other nurses, from other coworkers or other friends, that work at the hospital, because they have some legit concerns too as healthcare workers. So I took some time to research their questions as well. And the first question, and one that I hear the most of in my line of work, which is dialysis, is after these patients get the COVID-19 vaccine, will they test positive on a COVID-19 test? And the answer is no, they will not, because these tests that we're doing to test people for COVID-19 are only testing for active infections. So people who are getting the COVID-19 vaccine do not have an active virus, and your body is not going to act as if it has an active virus. There's no active virus in the vaccine whatsoever. But I would caution you to keep in mind that after our patients have been vaccinated with the COVID-19 vaccine, and a few days afterwards, maybe a week afterwards, their body is going to start having that immune response. And we need to use our judgment on whether or not we are sending these patients to isolation, because you need to use your nursing judgment to decide, does this patient have an active infection, or are they having an immune response to the vaccine that they just got? Because if you choose wrong, you could be potentially causing other nurses a lot more work who have to work with these people who are put on isolation, such as myself. The clinic that I work at happens to be the isolation clinic for our area. And people are so scared of this virus right now that, they're wanting to isolate patients for every sniffle and every headache just to be on the safe side, because COVID-19 is so very contagious compared to viruses like the flu, for example. So you can see why they would be very freaked out. But you do have to be able to know the difference, between an active infection and immune response. So if you do have a patient that comes in your clinic and they're like, oh, my body is just kind of aching, I've been running a low-grade fever, think to yourself first, did this patient get vaccinated anytime recently? Because if so, they're probably just having an immune response and they are not contagious. They do not need to be on isolation. So, let that sink in. Another question that I'm getting from other nurses and other friends, that I have is, why should we be trusting this vaccine? You know, they feel kind of the same way as the patients do, like that this was rushed. But again, you know, let me reassure you, the science behind this vaccine is not rushed at all. mRNA delivery systems have been, you know, being researched for decades. This is not new technology. It's just a new protein that we're working with this delivery system to make. And I can see where things that have gone on in the scientific community lately over the past year, especially with this virus, can be very confusing for healthcare workers because there's science and then there's sense. We have made some of our patients die alone in hospitals because of scientists that have looked at the numbers, and they're very like absolutists, and they're like, well, if we let people into the hospital to hold the hand of their dying loved ones, there's a small probability that we might not have enough PPE to make it through this pandemic. What do you mean you're not going to let people in while their loved one is dying? I think, in my own opinion, this was the most absurd move ever. Really? We had been conserving PPE like crazy, wearing the same PPE over and over again for days, reusing our masks, only being allotted so many per day. Do you know how hard it has been for us to get things as simple as hand sanitizer and Lysol spray, things that we use on a daily basis, are locked up like we're some sort of criminal or something? I mean, come on, healthcare. Let's get it together. We have enough PPE. We have enough hand sanitizer. We have enough Lysol. You don't have to be so dramatic. And your loved ones don't have to die in the hospital alone. There is enough PPE for everyone. I don't understand this at all. And I guess mostly because I have personal experience with it. It's tough, you know, for people who don't to see this point of view, because they're like, I've heard nurses say, for example, with my own family, when my grandmother passed away, you know, my dad could come into the room at the nursing home, and I could come into the room at the nursing home to be with my grandmother while she was passing away. Sorry, it's still really new. Sorry. But my sister couldn't. And I was like, really? Why? You know, I am a healthcare worker. I understand how things spread. You know, nobody was sick. Her room was right by the back exit. And the nurse was like, well, the more of you guys that come in, the more you put us at risk for getting this virus. So you and your dad can come in, but no one else can come in. And I just looked at her like completely shocked, because I was like, are you kidding me right now? We're putting you at risk? Actually, you're putting us at risk. We're the ones walking into the nursing home, which is a cesspool of viruses, especially this time of year with, you know, flu and strep and everything else, you know. And this nursing home did have a COVID unit, which my grandmother was not on, mind you. And I'm like, you don't go to the grocery store when you get home? You don't go to church? Your kids don't come to see you? And you're worried about my sister coming in to hold my grandmother's hand while she, you know, passed away? This woman was like a mom to us. And they legit weren't gonna let her come in. And I was just completely devastated. I was completely heartbroken. And I'm still like really ashamed of our profession for acting that way. Because, you know, I'm on the healthcare workers side of it. I see that perspective. but I'm on the family members side of it too, because I've been there and it's not right. So, nurses watching this, don't be an asshole, okay? Let people come back and hold the hands of the people that they love while they die. You're gonna be fine. There are a lot of healthcare workers out there that have this victim mentality, which, you know, is appropriate considering what has happened. I mean, they did not give us appropriate PPE. They sent us out there to fight this virus and people are dying. And now they want us to line up to be the guinea pig for the first tier of this unapproved vaccine that we don't even know works, and put ourselves at risk and just be like, yeah, here's my arm. And they're like, no, I'm not. So what I encourage you to do is go to credible websites like the CDC's website, cdc.gov, educate yourself how it's made, what clinical trials that it has went through, and the delivery system, you know, that it is working with, the messenger RNA delivery system. Educate yourself about it, and I promise you, you will feel a lot better about it, because it's not really us that we're putting at risk, it's all of the people around us. I will be fine. I am young and I'm healthy. I don't have all of the comorbidities that the patients that I'm taking care of have. You know, I am working with end-stage renal disease patients. None of them are healthy. You know, they are all compromised. A lot of them are actually end-stage renal because they have, you know, hypertension that's uncontrolled, or they have diabetes that's been uncontrolled for their entire life, or they were born with something that has wrecked their kidneys, or they've had medication in the hospital, you know, as a patient that has wrecked their kidneys. I've actually had one patient that has come to dialysis that had their kidneys wrecked because of having the COVID virus. Now, mind you, she did have a lot of other comorbidities, so it's not just like I'm saying that everybody that gets COVID is going to wreck the kidneys, but there is that potential. You know, if you're one of those high-risk people, then you really need to think about getting vaccinated. So I feel like as healthcare workers, and as the most trusted profession in the United States, that we really need to be educating ourselves on the facts. So when our patients ask us questions about this vaccine, which will be coming to our area soon, and some of you guys that are watching, it's probably already at your clinics and you're probably already giving it to patients. But I think that when we're educating them, we should stick with the format that says, here's the study, here are the risks, and here are the benefits, and leave it at that. Let's leave our emotions and our own, you know, past experiences out of it, because a lot of them, let's face it, over the past year have been traumatic. And, you know, it was really hard over this past year being a healthcare worker, and it's made people wake up and be like, do I really want to do this? You know, like, can I just work at the Dollar Tree, you know, or like, you know, do crafts all day? Nobody's life is in my hands. It would be fun, you know, who cares about the big pay cut? This sucks. I am never seeing my family, you know, and the list goes on and on and on. So you can see why people are so hesitant to get this vaccine. And, you know, our patients see this, they see our attitudes that we have when we're, you know, walking around thinking about these things, and we're talking about it with our coworkers, you know, and we're at the nurse's station like, oh, there's no way in hell that's going in my arm. Like, people overhear that and they get scared. So instead of injecting our own emotion and our own past experiences in it, let's just educate them the best that we possibly can, because they are looking to us for advice. They are looking to us for facts. They trust us, and let's not break that trust. I know this is a super tough topic and it's super controversial right now. And, you know, at the end of the day, You just have to do what you feel like is best for you, and, you know, practice nursing the way that, you know, your heart tells you that you should. We all genuinely love our patients. We love taking care of them. We all have hard days. We all have hard years if we're talking about 2020, but we get through it, and we get through it together. And I have found myself personally that I learn just as much from my patients as they do from me. And there is very rarely a day that goes by that I'm not learning something from one of my patients. Not even medical stuff, just getting to know them, just talking with them, and, you know, hearing about their life and hearing about their struggles. And the relationship between nurse and patient is so very important. And so that is something that I just want you guys to think about as we go throughout the rest of this 2021, to hold that dear. Don't take that responsibility lightly, because it means the world to them. They are looking to us, and there's a lot of times when, you know what, we're looking at them too. So thank you again for watching. Thank you so much for your support on this channel. If you have any questions about the vaccine that were not answered by this video, feel free to leave a comment below, and I will do my research and I will let you know the facts as best as I can. And if you know anything about it too that you would like to add, feel free to do so. Comment below and let me know what you think. Are you getting the vaccine? Are you not getting the vaccine? What are you going to say to your patients? Is there any like, I don't know, script that you've come up with that when your patients are asking you about this vaccine, like, should I get it? Should I not get it? I'm scared. I don't know what this mRNA delivery system means. Am I going to get sick? You know, tell me what it is that you tell them, and let's work on this together. Let's help support each other in this so that we can educate our patients the best way that we possibly can. Thank you again so much for watching, and I'll see you in the next video. Bye.